So welcome to Vivekananda Yoga University. We are the first yoga university outside India doing graduate education and research with online masters and PhD programs. So again, welcome, a hearty welcome. So let me just introduce our esteemed speaker today, Dr. Nick Shroff. He is a urologist, a cancer surgeon, a Yoga Alliance teacher, and a healthcare consultant. He's also, of course, our dear faculty here at VaYU, research and teaching faculty. He has practiced conventional Western medicine for over 4 decades, so 40 years of experience, and he has integrated his skills with modern holistic therapy. His technical skills and compassion have guided him to facilitate healing at a deeper level. Dr. Shroff is, worked, voluntarily conducted numerous yoga classes for yoga practitioners, seniors, and cancer patients for several decades. He teaches integrated medical knowledge that combines yoga and holistic living, affirming their validation by modern science. Dr. Shroff is the president of the American Prostate Cancer Foundation. He stands out as a social innovator, utilizing his education, experience, and leadership skills, especially for the elderly and underserved populations in low socioeconomic communities. Again, I'm really honored to call him a dear friend. Dr. Shroff, today he's going to talk about yoga and exercise-related injuries, a very relevant topic for VaYU audience worldwide. Yoga and exercise-related risks and injuries due to improper execution, inadequate training and overuse are underestimated and underreported. So improper, so hasty overextension, pushing too hard and too soon can cause sprains, strains, and pains. So physical activity, exercise in yoga can result in back pain, wrist sprains, hamstring strains, shoulder, knee, and hip injuries. So he will also focus on effective preventive measures, including adhering to a personalized approach and understanding one's body limitations, pre-existing conditions, and unique needs. So the message today from him will be: listen to the body, be grateful for its functioning, and appreciate your practice. Be mindful of precautions, tips, and safety measures, but carry on and go slow and be steady. So with that introduction, again, we are honored to have Dr. Nick Shroff. Nickji, the floor is yours. Thank you for your time.
Thank you, Prasanji. That is very good. So, yoga and most low impact exercises are generally safe, but yoga teachers and doctors are seeing more and more injuries. And like Prasanji mentioned, one of the things that I emphasize the most is overuse, misuse, and disuse. These are collectively called abuse. And so we are trying to educate our young people and recharge the older folks. So I teach yoga for several senior groups and also for some cancer patients. And I also teach yoga for people who want to become yoga teachers, so like we are training the trainer in the TTC. So I'd like to share with you what I've learned through the years. So the first thing is that let's kind of divide this with cervical, thoracic, and lumbar. So we're going to talk about yoga and exercise related injuries, the cause, the prevention, the treatment, and we're going to talk about sprains, strains, and back pain. Okay, so back pain is the leading cause of injury, worldwide. Okay, so we're going to start from the neck, go down to the back pain, and then talk a little bit about the shoulder, elbow, wrist pain, knee pain, ankle pain, and things like that. Okay, and all of these, the underlying problem is overstretching, overextending, twisting, misalignment, and repetitive strain, which is a cumulative thing. So repetitive strain is, every day there's a wear and tear, and this keeps on adding, and finally that's the last straw on the camel's back. Okay, so that's what happens. So now we have a whole bunch of pretty pictures. So I'm going to zoom through some slides. There's not much of writing and all that because I just wanted to show you some pretty pictures, and a picture is 1,000 words. So, and most of them are very self-explanatory. So I've shown you brought out some very simple pictures. So one of the things is overextension and jerky movements. and poor posture. All these lead to problems. See, when you talk about degenerative disc, this is spondylosis, osteoporosis, a whole bunch of problems can arise, and osteoarthritis, which is a wear and tear disease. So whiplash injury, a doctor friend of mine was going to the gym actually, and someone rammed into his rear end and he sustained a whiplash injury. So these are all problems that anybody can have. So it's not necessarily just yoga, but then he got some yoga treatment, he got some physical treatment and all kinds of things, and now he's much better. So even if the injury does not come from yoga itself or from exercise or from playing various sports, it can happen in various conditions. But just complementary medicine with yoga can help. Okay, so there can be mechanical injuries, sports, physical activity, all of these things have potential for injury. So one of the things that, let's start with this. This is called text neck. You see this person here is sitting on this thing here, the center of gravity, his neck is way down. Instead of that, he needs to take his iPhone and look up on it, not down like this, because that's the first and second cervical vertebrae. It's called the cervical flexion, the atlanto-occipital joint. So that's what they call text neck. Nowadays people loosely call this mobile asana, which is 45 degrees. See, the leg is 45 degrees. It's out of alignment. And because of that, some muscles are strong, like the levator scapulae and the scalene, the ones on the left side. And then there are some muscles become weak. They are underactive, like the sternocleidomastoid. So SCM is sternocleidomastoid. So the traction from the weight of the head causes stress to the neck and the shoulder. Remember, this is all a myofascial thing. So when you have text neck, you're not only treating the neck, but you're also treating the shoulder. Okay, shoulder and all the things, because this is a myofascial. This is all one connection. And because of that forward head posture, you get increased lordosis. This is called lordosis here. Okay, so we'll come back to this in another format. Let's look at this. This is called forward flexion posture, FFP. Now, the weight of the head is about 10 pounds, 10 to 12 pounds, and that's like a small bowling ball. Okay, but when the person is at 45 degrees that we talked about, the weight becomes almost 50 pounds. That's the weight of the head that you're carrying. So this is a poor habitual neck tilt. This increases the load on the neck, the spine, various muscles become weak, and they're prone to injury. So one of the other thing is that the shoulder is rounded, and that causes shoulder impingement. That causes tension headache. Okay, so it's the cervical and the thoracic spine curvature. So if you have a thoracic spine curvature, that also kind of brings the neck forward. So there are a lot of things that can cause it, and I'll share with you some of the treatment modalities that we commonly use. So one of the biggest reasons for this neck pain is yoga. This is Shirsasana. So this is the king of asanas. Okay, this is very good, and I do it every day. But then I'm used to it, and I've learned the proper technique. So this Shirsasana, this number 3 picture, I generally do not do this now because there is increased pain, and I don't teach that also because I normally do this. This is a yoga trapeze that I have. I can hang down here, this thing that lengthens the spine, reverses the direction of gravity, and it's very good. So I do this yoga trapeze, or I do a handstand, or I use a prop. See, the weight is on my shoulder and my neck is hanging loose. And so that lengthens the spine, and this is very good. So this avoids pressure on the head, avoids pressure on the neck or the spine. This is exactly what I want you to teach. So this is very good. This is the yoga trapeze. All right. Now, you can also do this rope yoga, Karunta. A lot of newer yoga facilities, many yoga facilities have this. This is extremely good. It's called rope yoga or karunta, that gives you strength, flexibility, core of the shoulder muscles, back, everything, because you're going to harness the rope. Okay, so it will support the entire body. And you can go deeper into these postures, various postures you can do. Okay, so you can do all kinds of things here, but this is rope yoga, karunta. This will help you to understand the body allocation, orientation, and you can notice the subtle changes in your body. Right? So just because the inversion poses are very good, they're very helpful. So then there is the shoulder stand. So that's also an inversion posture. So some people who cannot do a headstand because of the neck problems, they go into a shoulder stand or sarvangasana. But here also you got to be careful. Even this viprita karni, that is, you put the legs against the wall, even that can have problems, because here also you don't want to have over flexion. Extreme flexion is not good, because the artery, the artery and the vein, so there's the carotid artery and vertebral arteries. So that can cause dissection and can lead to a stroke. Or because of the vein, the blood clot in the vein forms because of sluggish circulation, because of the extreme flexion. And then that can also lead to stroke. And recently in the yoga magazines, they were talking about this stroke, where a yoga teacher was teaching a student, and the teacher had this stroke because the overflexion, so you have to be careful of the adverse effects. Once you get into the pose, even if you have to do it, you can do this happy baby, because that way also you can decrease the swelling in your legs and the edema or the dependent edema, and just be happy and just use a pillow there for the neck, and just relax, breathe slowly in and out. And you have to have awareness from your feet to the head while inhaling, and then from exhale, from head to feet. This is the common teaching that we do for yoga people. Okay. The other thing is that neck, when we're talking about the neck, the cobra position. I mean, cobra is very, very good. I do this during sun salutation, Surya Namaskar all the time. But you don't want to do extreme here. Nowadays, when I teach, I just teach them baby cobra. That's it. Because I kind of exaggerate that, because that way you avoid end range motion. And especially if there is some stenosis or some underlying problem of the spine, or there is a herniated nucleus pulposus. HNP is a herniated disc, basically. Herniated disc, then that can cause pain and discomfort. So, if there is pain, listen to your body, stop. Especially if you have pain in your neck or your back. Okay, this is the thing. So here also, there is active contraction of the extensor muscles. There are neck extensors, and there is a relaxation of the anterior here. So this is not good. So if you did have this problem, from whatever reason, yoga, exercise, or whiplash injury, or during your sports or whatever, one of the ways to treat is called SNAG. This is SNAG, sustained neutral apophyseal glide. So here, you rotate the neck in a pain-free range of motion. So ROM is range of motion. So if you do AROM, that is active range of motion, AROM. Or it could be active assisted, AAROM, active assisted range of motion. So there are various ways to do this. And I kind of want you to understand that here also avoid extreme bending of the neck forward or backward. So this is primarily about neck pain, because this is the thing. And that's the reason I like Sirsasana very much. It's the king of asanas. I do it all the time, but do it carefully, okay? Or use one of the props. Okay. Now we go on to back pain. So back pain can be due to so many different reasons. What I want to impress upon you is you need to use your body properly. Stand smart, don't slouch. Whole day people are in front of the computer. They are slouched, because like a question mark. So don't slouch, stand straight, small, sit smart, use a good back support. You can use an ergonomic chair if you want. And lift smart. That is the most important thing. See, when you're doing a heavy lifting, be careful, and I'll show you some pictures in just a minute about how you bend your knees and lift something. In general, avoid heavy lifting and movement that twist or strain your back. Okay, because there are so many conditions like this. So poor sitting posture is not good. Okay, all right. So this is about back pain. Now, so back pain is the leading cause of disability worldwide. Okay, it limits your activity. Okay, and this is again due to what? Repeated weighted like heavy lifting, end range motion, rapid movements, something too fast and too soon. Then forceful rotation, side bending, all these things can cause problems. So that's what you get, strains and sprains. Okay, that's what happens. Muscle, tendons, everything. So this is, now I want you to focus on this for a minute. See, this is the disc, and this is a bulging disc. Okay, so I'll show you the difference between a bulging disc and a ruptured disc in just a minute, right here. So you see this normal disc, beautiful, it sits between the two vertebrae. This is just a normal disc. This is a degenerative disc. See, there's a degeneration here, wear and tear. Then this is the bulging disc that I talked about on the previous slide. See, that is the bulging disc. You can see my arrow. Yes? So that's the bulging disc. Now, one step more than that, it becomes a herniated disc. That is called herniated nucleus pulposus, HNP, herniated nucleus pulposus. So this is the magnified view on the right side. So here is the vertebrae, and this is the spinal cord. Okay, spinal cord. And here is the herniated disc. And you see the nerve is coming out from here, this green thing that's shown in green. Okay, and then that can cause pressure, and that can cause inflammation. It can pinch the nerve, and that's why it's shown in red, angry red. That's what causes the problem. Okay, so the spinal cord is very fragile. You got to be careful. You got to respect it, no matter what. Because you can, besides degenerative disc, you can have thinning of the disc degeneration, osteophyte formation. These osteophyte formation are spurs. They're called spurs. And they can also, see, this is a bony spur right there. See, it's called bony spur here. Okay, so it can affect all of these things, including pain from the facet joint. See, that's the facet joint, and here. So I'm telling you all this so that knowledge is power. Once you understand this, then you can be more mindful and make sure that your alignment of your head, shoulders, spine, hips, knees, ankles, all are correctly distributed. So there is good distribution of your skeletal lobe. Okay, so that way you don't have any misalignment, you're not bending forward, you're not twisting and all that. Okay, because what happens then if you don't do this? See, for example, this girl, she's picking up something heavy. Okay, and she's picking it up the wrong way. So see that thing in red, angry red right there. Okay, so that is overpressure, causes problems with the interspinous ligament. So this is the spine. This is the spine here, and between the two spines, the ligament is torn. Okay, so that is called right there. See, it is torn. So that is the strain. And the sprain is this muscle. See, the muscle is torn. In reddish brown color is the muscle, and in white is the ligament. So I want you to understand that this can cause disc compression and pain. So we are trying to break down the exercises that break down your spine. Yeah, and that's the reason why you need to do yoga carefully. So in this full flexion, if you don't do it properly, that can cause increased injury to the ligaments and the disc. So here's the disc. Okay, so you saw that in the previous picture, this is the disc, the bulging disc and the herniated disc. So that is a cause problem. And people do all kinds of exercises and they can have an unsuspected bulging disc. So if you do too much of some wear and tear exercises and not give enough time for rest, then that can make it from a bulging disc to a herniated disc. Okay, so what is the message here? Avoid stooping down to pick up something off the floor. Off the floor, you want to avoid something. So keep your back perpendicular to the floor and bend the knees, and of course, avoid sit-ups because that produces large shear and compressive force on the intervertebral disc, the one I'm showing in my hand. Okay, so these are the things here. So what do you do now? How do you correct it? What is the correct way? For that, I'm showing this picture here. So if I have to lift something heavy, I come like a sumo wrestler. You're going down like that, and you can do a power lift. Okay, or I play golf like I used to play about 4 days a week. But this is the way you lift a ball. Bend the knee. You can even bend more than this. But this of your supporting leg, you bend the knee, and then the other leg, you leg straight out. You raise it straight out. That is for counterbalance. So your body is almost parallel to the floor. This is called a golfer's pickup. So this lifting technique will decrease the problem with spine injury, especially if the load of the weight, it's a heavy object, or even multiple times if you have to do this, like you're bending to pick up the ball 100 times during a golf game. So that's why you need to be careful. So it's a repetitive thing, right? So one other thing that I want to show, even though I show all of this, people have questions during the classes I take. And I'm showing you this because this kind of hits the nail on the head. So this is the stenosis. This spinal cord is fragile, okay? And you can have narrowing of the spinal cord or stenosis, that means narrowing. And this is the normal ligament, posterior longitudinal ligament. Everybody has it. But some people have it hypertrophied. That means it's bigger than hyper, meaning bigger, okay? And that can press against the spine, or it can become calcified, especially in older people. Sometimes they have calcification. So that calcification causes the pressure here. So it causes pressure on the spinal cord. And then this beautiful yellow color becomes red and angry here. Okay, so this particular X-ray was on a cervical stenosis. The same thing happens in the lumbar area also. So it can happen anywhere. Okay, so this is what I want you to kind of impress and be mindful of this problem. Yeah. Okay, all right. Then the other thing is, people always say sitting is the new smoking because the whole day people are slouched like this and they are not in a good posture. And remember, when you're slouched, your lung capacity is decreased by more than 30%. So, you're not even breathing properly. So, but here I'm trying to show you the differences in the lumbar spine with the intradiscal pressure. That means we use transducers. And we take a pressure between the standing and sitting posture. Lying down, standing, and sleeping. Lying down is the best. But even look at this, 140, okay? Whereas this is only 100. So sitting increases the pressure in the nucleus pulposus. That means this white thing here between the vertebrae, where my arrow is. Sitting increases the pressure in the nucleus pulposus at 40%. Compared to standing. Okay, so this is something that people have to be, most people are not aware of this. I was talking to a doctor friend of mine, and he did not even realize that when you sit down and you lift something, that is the worst. Okay, it's worse than even standing and lifting something. Okay, now, one other reason before we go on to something else is osteoporosis. So this is bone health. Now, bone health, when we talk about bone health, it's use it or lose it. I mean, that's the dictum. Everybody uses that. It's use it or lose it. This is the healthy bone. See the compact bone, nice and beautiful. That is the healthy bone. So that is the compact bone. Whereas the osteoporosis, that is decreased. See? So osteoporosis means, osteo means bone, and porosis means it's porous. So it's a porous bone. So you see the cancellous bone or the spongy bone, that is here, right there. All this part is almost eaten out. See this healthy bone. So this happens to be the section of a of the humerus. They cut the thing here like this, and this good section of the healthy bone and osteoporosis. So what happens in osteoporosis is the bone strength weakens, and it's susceptible to back pain, fractures, and all that. And people lose height, 1 inch or more of height. I have a friend of mine, he's about 80 years old, and he has lost 3 inches of height, 3 inches of height, So, and this can be due to various things, changes in natural posture, endocrine problems like parathyroid problems, which leaches out the calcium, thyroid problems, diabetes mellitus, or medications like steroids, diuretics, which leaches out the various calcium and all that, and PPI, that is proton pump inhibitors. So people who have heartburn, they take Nexium, Protonix, various medicines to decrease the heart pain or reflux. That's what they get that's PPI, proton pump inhibitors. So that is what happens here. So I want to kind of show you a little bit more about back pain, because I used to do halasana all the time, and I can still do it, but I don't teach this in my classes now, especially for the senior people, because this plow position, it's a full body stretch. It's a good thing. I do it all the time. I used to do it all the time, but it can cause strain and stress on the spine and the neck. So nowadays, I just teach this part. So instead of going all the way down, I just teach this part where, you're comfortably sitting, lying down here, and you use a chair and don't go all the way down. So you just inhale, lift the legs up, exhale, push the legs down to a chair behind you, and keep the shoulders and elbow on the ground. That's all. This is on the ground like that. Okay. Now, all these things that I'm telling you is based on various papers that I have read. This is books and papers and all that. We are talking about synergy of yoga with modern medicine. Okay, we are bringing synergy of yoga, modern medicine, and also using I teach yoga for golf and things like that, various things about, racquetball and all that. But this is something that you want to learn, soft tissue and bony injuries attributed to the practice of yoga. So there are injuries, and they may be, so a person does not have to have full osteoporosis. Between healthy bone and osteoporosis, there is an in-between line called osteopenia. That means decreased, little bit in between. There's a spectrum. And then that can cause higher risk of compression fractures and deformities. And that's the reason you want to avoid extreme spinal flexion. Because there is a risk, that's why when you discuss yoga with people, you tell them that there is a small but definite risk. I mean, yoga has hundreds of benefits, but there are some things, and you don't want to cause any harm to anybody, so this is better. So there are a whole bunch of papers that I've read, and I've kind of crystallized all these in some pretty pictures and kind of in my talk, so that, I'm talking to you about yoga and sports science. So I have several friends who are sports medicine doctors. They are orthopedic doctors and sports medicine doctors. And I've discussed some of these things with them. And they also now are understanding where complementary medicine comes. So yoga practices as preventative and as management strategy for musculoskeletal injuries and disorders. So we are talking about yoga practices for various things. So yoga should be integrated with exercise and sports medicine, because that will help you to prevent and manage musculoskeletal injuries. Okay. So here is this strength-based yoga exercise program. See, because people have this neuropathic pain due to lumbar disc herniation. So there are various exercises, and yoga can be a promising treatment option, but it has to be done carefully. That's all. Okay. And so it's not only the old folks get it. It's not just people who are 60 and above that have these problems. Don't feel that. Even young athletes, I have a doctor friend of mine, he's only 30 years old, and he has got back pain because of various athletic things that he does. So this is just a practical approach, and there are various exercises called McKinsey extension exercises and all that. But basically, I'll kind of walk you through some of the things. Okay. All right. One other thing is that, so don't be afraid, I mean, as long as you have the knowledge. So this is Pasarita Pado Uttasana. You can do good push-ups. This is also called a wide stance bend. So these are, you're stretching your hips, your hamstrings, lower back, and core muscles, and good for your shoulders. Okay. So this is very, very important because I want to kind of show you what happens with this. See, this is Pasarita Pada Uttasana. Push-ups, it's good for your shoulders, hips. One of the very, very good things. It's called a 5-pointed star because 2 legs, 2 hands, and your head is down on the floor. Okay. So then we use your arm as this thing touches the forehead. Okay. Okay. So here are the muscles. So when you do these exercises, you need to understand what muscles are being used. If you can, I mean, and when we do yoga teacher training, the TTC, like I mentioned, we are teaching the teachers. So we tell them what to do and how to think about the hamstrings. The hamstrings are here, these are the biceps femoris, semitendinosus, semimembranosus. So how they help to stabilize the pelvis and all that. So these are good for hamstring. People who have contracted hamstrings, the whole day they are sitting in front of the computer or driving, the hamstrings are contracted. And these are good exercises for that. But so energy flows where attention goes. Energy flows where attention goes. So what happens is, if they're mindful during the workout, you can get the best bang for the buck. Yeah. So you've got to be mindful during these leg workouts, and especially if you're doing this high intensity training, HIIT, high intensity training. Okay. All right. So this is one thing. The other thing is, when you're talking about back pain, you obviously want to know about sciatica. Okay. Sciatica is very, very important because a slip disc, herniated disc are the leading causes of sciatica. And this is the nerve originates, it's the longest nerve in the body. It originates at L4-5 and goes all the way down the back of the leg, and they can be in pressure in the pelvis, compression, pain, burning, numbness in the butt area, and all the way down to your ankles. Okay? And the cause, you can have sciatica if you have a little bit of spine problems already, forward bending, heavy lifting. If you have a bulging or herniated disc problem, arthritis, bone spurs, spinal stenosis, all these can make this sciatica worse. So there are tests that we do and how to do this. And then, of course, yoga can help to treat also these. So we teach people to do some cobra, modified cobra positions, locust positions, by child asana or balasana or shishu asana, downward dog, pavan muktasana, bridge pose. So these are disease conditions of sciatica, and we are telling you the cause, and we are telling you also how to help the treatment. Okay. So while we are talking about sciatica, there's one very interesting thing is that there is a small muscle here. It's a very insignificant muscle. It's called piriformis muscle. Okay. So that can be irritated. What happens is that the sciatic nerve can go underneath the muscle, or it can go above the muscle or through the muscle, and then it can get irritated. So the yoga pose that we do is this Ardha Matsyendra Asana. You're twisting, spinal twist, and pigeon pose. So there are various yoga poses that we can use, but the most common that we use is this spinal twist called Ardha Matsyendra Asana or pigeon pose. That's this thing. Okay. So here, now we are still, one more thing that we got to discuss. Here is the iliopsoas muscle. So normally in front of the mirror, people are looking for their six-pack, and they are always trying to do, work on the six-pack, the rectus femoris and those muscles. But here, this is a deep muscle. This is called the iliopsoas. This is the strongest hip flexor in your body, strongest hip flexor. And it's called the iliopsoas. Okay, it's a deep muscle stabilizer, deep muscle right there. So what happens is that this is the only muscle that connects your upper body to your lower body. And if the hip flexors are tight, there is an anterior pelvic tilt. And that causes weakness of the abdomen, the gluteal muscles, the butt muscles, and it causes hyperlordosis. So this is the importance of knowing this, because this is the only muscle that connects the upper body to the lower body. And there are really three muscles: the psoas major, psoas minor, and then iliacus muscle. So when you have to do this, this is very, very important to know this. Okay. So this will, if you do your core workouts properly with Pilates or yoga or various other exercises that we do in the gym, this will reduce injuries and decrease your back pain. All right. Okay. Good. We're moving along. Now, this is hip tendonitis. I'm going a little faster now because the pictures are already there and you can just see this thing. This is called hip tendonitis. And that is because of so many different reasons, Okay. So tendonitis can occur, we have so many different types of tendonitis. The tennis elbow is one type of thing, then golfer's elbow, and then there is jumper's knee, the patellar tendon. And the hip tendonitis is quite common, much more common than people realize, because there are about a dozen bursae around the hip. The most common, the picture that I'm showing you here is called the trochanteric bursa. See, this is the greater trochanter of the femur. Okay, and there's a bursa between that and the muscle. So this is the iliotibial band, and this is the tensor fascial ladder. See, tensor fascial ladder is here; it goes over it, and the iliotibial band. So the trochanteric bursa is here, and the bursa is inflamed, and then you can get hip tendonitis. So this is also again due to overuse, misuse, and disuse, and all together forms abuse, right? So these are the bursa around the gluteus maximus. This is the butt muscle here, the gluteus medius, gluteus minimus, the psoas muscle, the piriformis, all of these things. And then that can lead to more hip injury, leg length inequality, and all that. Okay? All right. So this is good that we have done this now. Now, talking a little bit more, I want to kind of tell you that many times we do this Ardha Chandra. So here, instead of standing and having problem with balance, this is called chair asana. We do a lot of poses on the chair. So this also improves the quadratus lumborum and the lats, the latissimus plus dorsi. So they're called lats, latissimus plus dorsi. So this is just a simple thing. You breathe in and then you go down and breathe out, all the way down in this thing, and you come back slowly, and then you can go other side. So you can do this standing and you can do this sitting in various positions. But this decrease, so if you're sitting for a long time, then that can cause stiffness, fatigue, discomfort, back pain, slouching, all that. So keep doing these things. These are called exercise snacks. Do these little things here. Or you can do this Ardha Matsyendra Asana. See, you can go back. So your spine can go in 6 directions: forward, backward, then left side, right side, and then twisting, right side and left side. You can go all these things. So you can do all of these things and try to do these exercises. If you're sitting more than 20 minutes, spend a couple of minutes and do this so that you're not having stiffness problems. Okay, that is important. This is very, very important to do this so that it kind of releases the tension around the spine also. Okay, and have fun when you're doing this. So this is the John Travolta pose, right? Yeah. So when you're doing this seated Trikonasana, you can do the John Travolta pose. Think of John Travolta, Saturday Night Fever, whatever. All these things are helpful. Or you can do the Garba thing, that you can go like this and let go, come here and let go like that. Or you can do this thing, the Bhangra, where you screwing the light bulb. So you're screwing the light bulb and you're going this side and you say, I don't know, you keep going. Or you take from the lower shelf and put it on the upper shelf. Go on the lower shelf and put it on the upper shelf. Like that, you can do all of these things, simple things you can do. You're movers and shakers, right? So you can move, shake, 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 shake. See, you see little animals and kids also do this all the time. They shake, little babies do that all the time. They shake, 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 shake. So that is what happens. So always have some fun, and that's the reason I tell you that if a teacher makes students laugh, they will walk away remembering what they have learned. Okay, because this is important. This is just a simple seated warrior pose. Okay, and then we have this kanda. This is also important. So you bring this elbow to point to the ceiling. Okay, and then you can go up and down like that. Okay, so these are simple exercises. I'm just going to zoom through some slides because this is the extensor carpi. This is the tennis elbow, and this side on medial is the golfer's elbow. I'm just going to go through this. This is Gomukhasana, and these are all things that you can do. And just think of the muscles when you're doing this. Okay, think of your muscles when you're doing this. Very, very important, and it'll help. And this is tennis elbow. I want to spend 30 seconds here. This is the scapula, and this is the acromial process. So this is the rotator cuff tear, and it happens many times, and it can also happen if fall on an outstretched hand. This can happen, people, sports injuries, downhill mountain biking or skiing or football or anything, it can happen. And this can happen here, supraspinatus tendon. So there are 4 muscles here. This can tear. The treatment can take sometimes months together. My swimming coach, when I did some competitive swimming some time back, she had a rotator cuff injury, and she couldn't get qualified for the Olympics because of that rotator cuff injury. She ignored it for a while, thinking it will get okay because of the stress of the competition, and that only made it worse. Okay, so shoulder can also get dislocated, so you have to be very careful. Okay, and then this is YWLT. So if you're sitting whole day in the south, you do a Y and a W and an L and then a T. YWLT. So this decreases the slouching. You can also do this, stay centered, calm. You can do these. You can do the Janu Sesasana, where you're touching your forehead to the leg. These are all simple exercises that you can do, yoga on the mat, off the mat, or if you cannot do it standing, do this sitting. Remember, props can set you free. This is just a chair, that is turned up, and props can send you free. Use a chair, a blanket, a mat, pillow, cushion, anything. Then but keep the props secured and fixed. So this is the same thing that we saw in the previous one. Or you can do this one here, the hips are square and even, Kaputasana. See, simple thing, but this is the modified thing. This is not the extreme version. This also helps for people who don't have a full this thing. Or even you can do this. This is just a balance pose. If you cannot do the balance pose, then you can use this hand here. This is the Uttita Parsvakonasana. See, oblique muscles. Here also the lats, the latissimus dorsi, quadratus, serratus anterior, all of these things. So you need to find the length on the side of your body between your fingers and the heel. So that is all one line. Or if you cannot do this on the chair. This is the same thing. This is a extended side angle pose. This is what we do for preparation for sun salutation. Okay? Or you can do this Vasisthasana, see, side plank. Simple thing, just go there, use the chair and do it. You can do the same thing here. Or you can do this. See, this is that Vasisthasana. Instead of the chair, you can do like this. Or you can do on the chair, or you can do like this. See, these are all, if you cannot do this one on the right side, and if you're worried where you cannot hold this thing on one hand, just do it on the chair. Or the same thing is here. So the front leg activates the hamstrings because your hamstrings are tight and adductors. And the back leg will activate your hip flexors. So this is Hanumanasana. And I'm showing you the props, but you don't need the props after a while, because once you get some warm up and you do this, you won't need the props. Or if you practice this for a few weeks, you won't need the prop. But a good stretch is very good, especially before you lie down to sleep. This is very good. So these are yoga is stretching. Yeah. Or you can stretch like this. Upavishta Konasana, Dandasana. See, you can go there and you can touch this all the way down here. Normally I have another picture. It just touches, the head touches on the ground. Or you can go as much as you can, but don't strain yourself. Just do this. Fine. You can do this also. Navasana. You can do this here. Look up in the toes, or you can do this Vrikshasana like this. Anything you can do. This is also improves the flow of the reverse balance stop. See, yeah. So this, but always synchronize with your breathing. Breathe in through your nose. Breathe out slowly. Abdominal breath. Okay. This is the Paschimottanasana. And this is okay. Now this is important. When you go to the gym, just do this thing here. This is called, hanging leg. Julasana. Yeah, very nice. It goes, but don't shrug your shoulders and don't cause back pain. Just do it properly where there is maximum voluntary contraction and you're going up like this and opening up your legs. That's all. Okay. So this is good. And then, so yoga is good for flexibility, mobility, and all that, but it does not give you, it's not a mindful this thing for weights. You need some strength also. Otherwise, you get sarcopenia. So don't be a weekend warrior. Do this every day. Just, you don't need to go to 25 pounds and 30 pounds and all that. Just 15 pounds is enough. Just use this, go up, and then make sure that this external rotation does not cause shoulder impingement. That's all. Do the strength training properly. Or you can even do this, So it's not the load that breaks you down. It's the way you carry it. So learn the proper way how to do this, Or you can use this, if you don't want that, you can use this. These are just like resistance training, resistance bands, okay? Or the other thing is, I go to the gym all the time. I see people using the knotless and the forward is right. Bring it forward. Don't bring it back. This is wrong, okay? Because if you go behind your head, that causes hyperrotation, stress, and damage. So behind is not good, okay? So this is also the same thing, impingement, upright row. And this is the Valsalva technique. I just wanted, okay. This is just a little bit more about weightlifting. And this is the chest fly. Okay. I think Prasanji would like to say a few words. He told me to stop now. So this is at the end, we just do this thing here where you inhale. This is kind of, chill out, inhale, 1, 2, breathe out, and you do pursed lip breathing, decrease your stress, anxiety, and all that. You can carry the same thing down during your sports also, whatever you're doing, scuba or whatever you're doing, rock climbing, anything you're doing, use this thing properly. And then have some fun. So positive thoughts can be shadowed by full of negative thoughts. So don't tell this, have fun. And this is my disclosure. Okay, does not constitute or substitute medical advice. Okay. Thank you.